This week, I introduced a bill to fight healthcare fraud. This bill is aimed at actually preventing fraud. Every dollar lost to fraud shortchanges both taxpayers and Medicare beneficiaries. And in the process, it seems like the bad actors are getting bigger and bolder all the time. This bill would require public disclosure of Medicare claims and payments. Now, the way it is today, we've got defense program spending that's more transparent than spending by Medicare program. Disclosure is important because of the public's right to know, and the transparency that comes with it obviously leads to greater accountability. My bill also would reform Medicare's prompt payment rule that doesn't allow Medicare officials to delay payments even when fraud is suspected. My bill also would let the Inspector General exclude individuals from participating in the federal health care programs if those individuals have been affiliated with known fraud in the past. Finally, my bill would stop Medicaid payments for drugs that have not been approved by the Food and Drug Administration. This fraud prevention bill fits in with my other efforts to fight Medicare fraud, including successfully recovering tax dollars lost to fraud through whistleblower provisions of the False Claims Act, which I updated in 1986 and which continue to fortify because, you know, there's always somebody out there trying to weaken that very good piece of legislation. A lot of people, in fact, would like to gut it altogether. Now, you know, since 1986, this Fraud Claims Act has recovered $28 billion that otherwise would have been lost to fraud. And secondly, I'm asking tough questions of the Justice Department about criminal prosecutions involving healthcare fraud. More federal dollars are spent every year on this effort, but the number of prosecutions hasn't necessarily gone up. They should, as a matter of accountability and as an effective deterrent against healthcare fraud.